This is the Q&A session for the Challenge 7, how can we make NHS waiting time system more efficient and effective? I'm Barbara Mills, I am Challenge Sponsor Manager with CivTech.
I'm Jonathan Cameron, I'm the Challenge Sponsor for this, and really looking forward to hearing innovation and ideas to solve what is a major problem for us in the NHS.
So can we start, Jonathan, by with the question, what are the key elements to coordinate in terms of this challenge, in terms of beds, doctors, ward availability, etc.?
Sure. So there are a number of things that we're looking to really address in this challenge, and the key thing for us is actually staff. So making sure that the right people are in the right place at the right time. Beds is another key factor in that. And the other thing we're trying to build in is patient preferences. So trying to understand if there's a particular reason for people not wanting to make a particular appointment slot, and trying to build that in. So I suppose that's all done very manually at the moment. And there are quite a few examples locally where there's a very large team who do nothing but speak to patients, who speak to staff, who spend a lot of time tracking down what beds are available that day or that given week. And we think there's a huge opportunity to try and make that automatic. So using some of the new AI or machine learning type techniques, or just very simply just making it easier for staff to do the job that they really want to do.
Great, okay. And that leads nicely into our next question, which is, can you give us some specific examples from current practice of the issues that you'd like to address?
I think the one area that really comes to mind is hip operations. So the number of hip replacements in Scotland is increasing quite rapidly. And although it's not majorly complicated surgery now, it does require a stay in hospital. It does require pre-op work. And I think as the demand grows, the waiting list for that operation is growing, and that's leaving patients in pain, and that's a situation we don't want to happen. So what often happens though is because not every appointment slot is taken, or not every operation is managed to be carried out that day, there's either a tendency to overbook, or there's cancellations on the day. There's an unforeseen event, or someone simply can't make the time they thought they originally could. So we really want to try and see if there's a way of also breaking out of it just being the sole responsibility of that hospital or even that ward. So if there's someone on a waiting list, maybe in a nearby area, could they take that slot if it's available? So it's about making the capacity more available to a wider group of patients. So hospitals are actually very good. They are actually reasonably efficient in managing within their own confines of their hospital or even within their own board. But we need to go beyond that, and we really need to expand that both regionally and nationally to try and really maximise the capacity we have available, but also really to try and see what opportunity we have to reduce waiting times, which, as I say, is a major issue.
Next question. Is this about efficiency of resource management?
The short answer to that question is yes. So resources both in terms of staff, but also in terms of equipment. And there can be some challenging occasions when you need very specialised equipment to be available. So making sure that that's highlighted and ready at the right time can have a big impact as well. And also patients themselves. In this regard, you kind of think of patients as a resource in themselves. So trying to merge or trying to manage all these very different parts together is what we're trying to do with this challenge. So resource management absolutely is a key focus.
What would be done in terms of a national effort?
So we've stepped up to lead this challenge, although recognising that we're going to need the support of all the local boards. But one of the big things about CivTech, and one of the big things that we want to see happen from this, is for this to be done at scale, and to be done quickly at scale. Although we'll initially have an MVP, we already are thinking ahead. How do we take the learning and the knowledge that will arise from that, and how do we quickly implement it at scale? It's also because we're sitting with a lot of the data nationally. We're ISD are the organisation responsible for reporting and managing all the data for the NHS. So there's resources and information that we've got that could potentially be a big help or a big factor in deciding potentially which area do you prioritise, or just in helping people get to the MVP that they need to. So we're very keen that this is seen as a national approach. We're big believers in once for Scotland, and there has been a tendency in the past for some really great work to be done, but it's done in a very localised way and it isn't easily spread elsewhere. And we want to really build that in up front, so that's why we've placed a lot of emphasis on it being national.
Okay. In that context then, who do you see the first customer as? For example, is it going to be a specific NHS Health Board area?
Sure. So although we're a national board, we're not a frontline board. So we have engaged and reached out to 2 boards. Delighted to confirm that Golden Jubilee will definitely be one of the pilot areas for this, and that's very important because they're the national centre for particularly again hip replacements and another sort of very critical surgery like cardio. And we're also keen to work with NHS Lothian as well. And it gives us a different flavour and a different emphasis. So Golden Jubilee is a national board as well, so they take patients from across Scotland. And NHS Lothian obviously has responsibility for the patients in a more localised context, so Edinburgh and surrounding areas. But both boards, and NHS Lothian in particular, are really interested in understanding, how could they get better at managing their waiting times. And NHS Lothian in particular have a big pressure with rising demand. And they are very interested in innovation and new ideas for how we can solve this.
Great. Okay. So next question we have here is it possible to prioritise key demographics?
We're not going to prioritise by demographics. So our thinking so far for the MVP, although again this is the sort of thing we will discuss as part of the exploratory and part of the accelerator, but we think we definitely can't do everything. So it's right that we do prioritise on something, but it's likely to be on clinical specialty.
Right.
So it could be on cataracts, it could be on hip replacements, which I mentioned a few times, it could be cardiology. So anything that's maybe a little more complex or potentially something that's quite high volume. So both cataracts and hip replacements actually stand out, or orthopaedics more generally, because of the volume of operations that are carried out. And if we can take some of that pressure away from routine but high volume tasks and have a tool that's able to do some of that for the frontline staff, you release more time to deal with the more complex cases, or you release more time to care, to go and speak to the patients, to make sure things are working as they should be. So it's about taking them away from the spreadsheet, away from the computer, and then potentially giving them more time with patients.
Great. Okay, that's helpful and very clear. How do we understand the resources of a given hospital is the final question we've got for you here.
Sure. So again, that's why we're going to make sure that there's time to engage with both Golden Jubilee and Lothian. And there are sometimes various systems in place already. So there are staff rostering systems, for example. We're not too worried about that. We're quite flexible about what systems we might need to engage with or integrate with. We really don't want to propose what the solution might be. And again, coming into CivTech, we are looking for the ideas or the things that we haven't thought of before. But yeah, there certainly will not be any shortage of data or access to staff, or if we need to integrate with a particular system, we will certainly do what we can to support that. But yeah, it really depends on the solution that's proposed and how the exploratory and potentially the accelerator works out.
Great. Okay. Well, that concludes all of the questions that we have for this challenge. Thank you very much, Jonathan.
Looking forward to it. Thank you.
Great.